welcome back to the channel. I hope that everyone's doing well. It is Monday afternoon and I am actually in the pickup line to pick up my oldest son from school, and my little one, he's like passed out back there. So I thought that I would actually hop on here and do a little update for you guys. I did one when I had hit 1 month after working as a new nurse practitioner, and I am officially almost 4 months. 4 months in my new role as a nurse practitioner. Well, practicing. Longer I've been licensed, but actually working. I've been working for almost 4 months at a local urgent care, and I gave you guys an update, like I said, after 1 month, and kind of let you know how I was feeling. I was feeling a lot of nerves and anxiety just about transitioning, and so I thought I would hop on here and let you guys know how things are going now. So they're well. Like, if I were to only say one thing, you know, it's going really well, actually. I like my office. I like my coworkers. I like the urgent care setting. I think it's very in line with my nursing experience in the past. Like I told you, I worked in the ER, and I'm just very familiar with this type of a very focused assessment. You know, I'm not doing a head to toe. It's not comprehensive like that. It's very focused on the matter and the problem at hand. And so I would say that has been probably an easier transition than maybe some other roles would have been for me. Of course, it's always good when you get along with the people that you work with, so I appreciate that part of it. I did get a raise when I hit 3 months, so that's really great. Okay, so I'm going to touch on some of the things that I talked about in my first 1 month update and kind of tell you how it's gone. So I know I was telling you that I was really, really anxious and going home and questioning things that I was doing. So I'm not going to lie to you and say that I don't do that at all anymore, but I do it a lot less. And so I'd say that's progress. I told myself, you know, I'd give myself 6 months to, you know, get into the flow. I would definitely say that over time, my anxiety and my questioning my skills has lessened. And so I hope that you keep that in mind if you are just entering into your role, to give yourself grace, because after time, you will start to feel more comfortable with the decisions that you're making and just your new role. For charting, I have definitely gotten the hang of that. Charting I can do much quicker now. I'm not doing hours after my shift of charting. The other day I had to work it was open to close, 9 to 6. It was a Sunday. I had to work 9 to 6, and I was the only provider. And I saw 46 patients, which, I don't know, it was a lot. I'll just be honest. It was a lot. And yeah, I definitely did not finish, you know, my charting on that day. I took it home. That's the exception, not the rule. I would say majority of the time I'm able to finish most of my charting, if not all of it, by the end of my shift. So that's been really nice. I can actually go home. I can clock out and go home and just be present, and that's a really great feeling. Overall, I would say my understanding of my role, my skills, everything is continuing to improve. Not 100%, of course, but I'm definitely getting used to the flow of working as an NP. I see a lot of upper respiratory stuff like right now. Obviously a lot of people are coming to the urgent care that are acutely sick. I see a lot of orthopedic stuff. That's a big component of people that are coming into the urgent care. There is always some random off the wall. My least favorite for sure are when patients come in either A, with dizziness, or B, obviously abdominal pain. Like those two, you're like, oh, this could go so many ways. So those are my least favorite for sure. I've come to the understanding that it's okay if I don't know the answer right away or at all, you know, as long as I know where to look, who to refer to. This was kind of crazy. Well, not crazy in the sense that I was so excited that I correctly diagnosed something, and it was like so textbook, which I feel like you don't usually see things that are so textbook. Usually it's, I don't know. Okay, I'm just gonna tell you what happened. So this girl came in, a young girl in her 20s. She had a rash, and it was like kind of sporadic. Also, I don't really love rashes. I'm not a dermatologist. I'm getting better, but anyway, Brittany. And so she had like a couple splotches on her thighs, and she had some on her wrists, and they were very like pinpoint dark red spots. They did not itch her, and she had noticed them for the last couple days. And actually some of them had already dissipated by the time she came back, but there was some remaining, and it was very dark red pinpoint rash. And she's like, I think I'm having an allergic reaction or something. I said, you know, that's so weird. That looks like a morbilliform rash. And I asked her if she had been on any medication recently. She was put on amoxicillin. She had had dental work done 5 days ago, and they put her on amoxicillin prophylactically, and she did notice the rash a little bit after, and so she's asking me, like, does it mean I'm allergic to the amoxicillin? I said, no, actually, the morbilliform rash would often show up in these children that were treated with an antibiotic basically incorrectly because they actually had mono. And so if they had mono and they got this antibiotic in them, then they had this morbilliform rash, and it was often mistaken for an allergy and all this stuff. So I said, why don't we check you for mono? And she did say, like, wow, I've actually been more tired than usual lately. So we checked her for mono and it came back positive. And like, I don't know, I was just like super excited. So I told her to stop the antibiotic. I told her to obviously, like, no physical strenuous activity, contact sports, until she was cleared basically by her primary care to make sure she didn't have like splenomegaly. And I palpated. I didn't feel any like spleen enlargement or anything like that. I think she's going to be just fine. I was so excited to actually have like that validation right then and there with the positive mono test. I'm like, yes, this is it. I'm such a nerd, but that's really what happened. And then obviously, there's a lot of COVID stuff going on right now. I feel like we are coming back into a little bit of a peak in my area, and we do see COVID patients. So we've been testing a lot. I've been seeing some of it. I've also seen flu A. I've seen flu A a few times, which is kind of crazy because I didn't see flu at all last year. I am seeing some positive COVID. I called the patient today that tested positive on one of his send-out tests that we did. We do have the rapid PCR, but we don't always use it. We have to follow an algorithm. This wasn't even my patient anyway, but I'll get there. We did a send-out COVID, and he was positive. And so I called him today, and he fit the criteria. He was in his 70s, history of high blood pressure. And so I called him to tell him that he was eligible for the monoclonal antibodies. He was like 4 days with symptom onset, just like body aches and a cough. But I sent him today for his monoclonal antibodies. So that last presentation I did about COVID and outpatient management, for me, that's super relevant right now. That's a lot of what I'm doing, is either treating COVID patients or patients with other viruses, because everybody and their mom has something upper respiratory right now. I'm also getting like daily emails from my kids' school saying that they have another positive COVID case here, another positive COVID case there, but take no action. It's not in your classroom. It seems suspicious. Knock on wood. Can we just like all agree that this pandemic blows? Anyway, so to recap, the transition is going well. Things are going well for me at the urgent care. I want to hear from other of my fellow new nurse practitioners on here. How is it going for you? How are you doing? What is going on with you? We have a few new nurse practitioners now at the office I'm working with, and they just graduated, so I have like a few months on them. They'll ask me a question and I'll be like, oh girl, let's find out together. Medicine is that, like, you're never gonna know everything all the time. Every day you should be learning something. I am always researching anything that comes up that is puzzling, or any unique patient or medical. I'm always researching. But yeah, learn something new every day. Keep me posted. Let me know how your new job is going as a new NP, and I will talk to you guys very soon, hopefully. All right, have a great day, guys.